Hello, my name is Stephanie Duregger, and today I will be presenting about nursing leadership qualities for my senior capstone video presentation. For this presentation, I will first discuss the leadership components of patient advocacy and critical thinking with examples from my experiences during my capstone clinical. Other components of leadership that will not be heavily discussed in this presentation include communication, evidence-based practice, creation of a nursing care plan, and implementing a vision. So after I discuss patient advocacy and critical thinking, I will then describe some of the resources needed for nursing leadership development. These will be resources I have discovered on my unit at Mayo Clinic. Because Mayo Clinic is such a large facility, I will also discuss some of the multidisciplinary teamwork that occurs, as well as some technology available for nursing leadership support. Lastly, I hope to conclude with resources provided to the nurse for leadership support, as well as some other areas of this support that are lacking in the cardiac surgical PCU. Overall, the main purpose of this presentation is to synthesize characteristics of leaders while acknowledging leadership components and resources available to nurses on the unit. For every nurse, being a patient advocate is critical to provide the best and safest care for our patients. Advocacy can be defined as expressing, protecting, and defending the cause of another. It is important to protect our patients' rights and advocate for the care they deserve. Nurses need to empower their patients and be aware of the increased need to advocate for vulnerable populations, such as the elderly. The next slide will show a video depicting an example of patient advocacy that I have encountered with my preceptor. So one example of patient advocacy is when we took care of a patient that was in her 70s that had a laminectomy. We took care of her 3 days after her operation, and she was still very weak. She continued to have extensive pain at her incision site, pain that radiated down her thighs, and extensive nausea. She had been receiving oxycodone every 2 hours for pain, which made her very drowsy. When the resident came in to inform her that she needed to be discharged, she could barely stay awake. In this reenactment, Izzy will be the patient and I will be the nurse. This is a conversation that occurred after speaking with the resident about discharging. Hello, Mrs. Kleenex. How are you doing today?
Well, not so good. That young doctor said that I might go home.
Oh, and how are you feeling about going home?
I want to go home.
Okay. Will there be anybody to help you when you do go home?
Well, at home I have my husband and my sister. And my sister will come. 11.
Okay. And do you think your sister and or your husband will be able to provide the care that you will need when you go home?
I mean, they might be able to pick me up. Maybe.
Okay. Is do you think your husband and your sister would be physically able to do that for you?
My husband has a bad back.
Okay.
And he won't be happy about it.
Okay.
If it's just him, I don't.
Okay. Well, if you're kind of concerned about your safety, I was kind of thinking that maybe it might be a good option for me to talk to a social worker to potentially figure out how we can set you up with maybe an alternative place to go just for a short time instead of going back home. Some of those able to give you a little bit more help than your husband and your sister may be able to provide. Okay. Well, I'm going to go call the social worker, and we will see if she'll be able to come and chat with you. How does that sound? Okay. And that was an example of patient advocacy. So from that video, we can see that the nurse was able to advocate for her patient by empowering her to recognize the difficulties that she may face if she would go back home before going to another facility first. Now we will be moving to critical thinking, also known as problem solving. This is another very important component for the development of the nurse leader. There are many situations that occur each day that need to be critically analyzed in the healthcare practice. The nurse needs to be time conscious and diligent to provide the best care for the patient. Critical thinking skills in the nursing practice takes experience, but can be obtained with the use of the nursing process, trial and error, and the nurse's intuition about the situation at hand. The following video shows an example of a patient that my nurse had to critically think about to provide her with the most holistic and best care possible. Okay, so this scenario is going to depict critical thinking. So in one of the units we floated to, my nurse preceptor and I had a patient who had a J-tube and was receiving tube feedings through it at a very small amount of only 20 milliliters per hour. At home, the patient had been receiving 77 milliliters per hour. This small dose was being given because of concerns related to the usability of the J-tube at this time. The patient's abdomen was very distended and bile was escaping from around the J-tube. The patient was also on a ventilator and was under a light sedation because of the medication error with phenobarbital that had actually been committed by a nurse the day before we cared for this patient. In this situation, Izzy will be the patient's mother and I will be the nurse. Knock, knock, knock. Come in. Good morning, Mrs. Kleenex. How are you doing today?
I mean, I'm doing good, but poor Sue. I mean, she looks like she's not getting any nutrition, and she still hasn't woken up.
Okay. Has anybody been around to see the tube? Because I can see it looks very inflamed and looks like the skin is breaking down quite a bit around it.
It looks horrible.
It does look horrible.
And the nurse from the prior shift, I keep grabbing them to have them look at it, and she says some skin team is going to come see it.
Okay. Well, I am going to go call that skin team right now and see if they will be coming today or when they will be coming, just to make sure that you're here during that time when they come, because I know that this is very important for you and Sue with this skin breakdown.
Yeah, I want to see what they have to say.
Okay, well, I will go call them right now. Is there anything else that I can get you for right now?
Besides the skin team, no.
Okay, well, I will go give them a call and see what we can do. All right. Ding, 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 ding. Hi, my name is Stephanie Duregger, and I am taking care of Sue Smith in room 101. I was wondering if you were still planning to come and look at her J-tube site. I don't know if you have any idea about that. We have actually been having to replace the gauze around the site about every hour because of the extensive drainage. The skin around the site is actually really broken down from what I'm assuming is bile coming from there. The color is kind of a fire engine-y red, and I really think that it would be beneficial for you to come and look at it.
Okay, I mean, I just took a look at it, and and my colleague was supposed to stop in yesterday, but I don't know if she ever went around to it. I'll stop by this afternoon.
Okay, that would be great. Do you happen to know what time that might be?
Anywhere between 2 and maybe 3:30.
Okay, thank you so much. I will see you then. Bye. Knock, knock.
Come in.
Okay, so Mrs. Kleenex, I just talked to the
Skin
GI
team.
and they are planning to come around this afternoon to look at this site. So until then, what we're going to do is we're going to keep replacing the gauze to just really prevent infection at that site, maybe clean it a little bit, and just to really prevent infection. And then another thing that we can do, since she has been receiving the tube feeding at such a low rate, I am kind of worried about her nutrition at this time. And some of the risk factors for like skin breakdown can be inadequate nutrition and not moving around a lot. And since she's pretty drowsy right now, that's something that we're really going to work on until the doctor comes. He said that he would be here around like 2 to 3:30, somewhere in that range. So if you want to be here at that time, since I know that you're kind of Sue's primary caregiver at home. So until then, we're going to really think about skin and really try to see what we can do related to repositioning until we get a plan for the skin breakdown, because it's really important to think about infection at that site, especially because that's where. From this video, you were able to see the nurse critically think about not only the skin breakdown at the J-tube site, but also to think about her increased risk for a pressure ulcer because of the inability to receive adequate nutrition at that time. The patient was also not able to get up out of bed, so it will be important for the nurse to reposition her every 2 hours and critically think about how the ineffective J-tube is impacting multiple other body systems. So another example of critical thinking is when we had a patient who had severe nausea when she got up the first time after surgery, and we were walking down the hallway, and then all of a sudden she just got severely nauseous. As the nurse, it was our responsibility to first keep her safe and make sure that she remained stable and didn't fall over. But also we were critically thinking about not only the pharmacological options that she had ordered, but also trying to think of what we could do right then and there. So not only keep her safe, but also think about some non-pharmacological options such as aromatherapy or just going back to her room to rest to see if that would help the nausea at all before resorting to the pharmacological options. Alright, so now that I've discussed patient advocacy and critical thinking as components of nursing leadership, I will now discuss some of the other components needed to support the nurse as a leader. One of these is the need to work with a multidisciplinary team. From the previous video related to patient advocacy, it was important for the nurse to reach out to the social worker. The nurse knew that even as a leader, finding a nursing home facility for the patient would be better coordinated if another member of the multidisciplinary team was involved. As you can see from this picture on this slide, there are many patients for the nurses to take care of, but also many team members that the nurse needs to collaborate with on a daily basis. Because Mayo Clinic is such a large facility, the multidisciplinary team model can be complicated because of the thousands of different employees within each specialty or area. There are teams for just about everything, as well as specialties like PT and OT, on top of the patient's team of doctors advocating for their care. On the cardiac surgical PCU, the nurses collaborate with other disciplines for a variety of different reasons. This teamwork is supported most of the time on this unit when other specialties need to be consulted with. Some team members are more supportive than others. If the team member is not as supportive and willing to support the nurse as a leader, the nurse's ability to advocate and critically think may be negatively impacted. Teamwork involves clear communication and knowledge about how the other member of the team is going to contribute to the care of the patient. When all of the members of the healthcare team effectively work together to provide the most effective care for the patient, the nurse can continue to lead on his or her unit. It is important to realize, especially as a new nurse, that we cannot know everything related to critical thinking and advocacy. Sometimes we need to collaborate with other members of the multidisciplinary team and to ask for their support. Not only is it important to have a multidisciplinary team to support the nurse leader to critically think and be a patient advocate, but also to have resources available to guide that nurse. From my Capstone clinical experience, I have been able to discover many different resources available to the nurse on the unit. One resource that supports the nurse as a leader is the support from the charge nurse, nurse managers, clinical nurse specialists, and clinical nurse educators. Other nurses on the unit can also be a really great support for the nurse as a leader. All of these personnel support the bedside nurse by assisting and giving advice when the nurse is struggling to properly advocate or critically think about what is best for the patient at that time. So besides support from other personnel, technology can also be a very beneficial resource to help nurses to grow as nursing leaders. Many evidence-based protocols can be obtained from the facility's computer database. Research can be conducted about the evidence related to an intervention to ensure the nurse leader is providing the best care based in evidence. The nurse can also obtain information that can help him or her to critically think about the patient's disease process, as well as additional resources the patient may need before they are discharged from the hospital. It can be helpful to research the role of, say, for example, like a social worker before calling them when the nurse leader is advocating for his or her patient. In the cardiac surgical PCU, one resource my nurse expressed would be beneficial to assist her to be a nurse leader would to have more knowledge about the information that is gained from the meetings that are attended by the nurse managers and the clinical nurse specialists. She explained that it is very irritating at times because they gain all this information and is briefly shared in an email, but there's never collaboration between the people higher up in the management chain to the bedside nurses. She also wishes that there were more opportunities to be involved in committees. There are a few committees that you can be involved in on the unit, but they require you to be in that committee for at least 2 years. Some nurses don't know if they will continue to work on this unit in 2 years, so this is another area for leadership support that could be improved. In the cardiac PCU, one resource that is critically needed to provide an environment that assists nurses to become leaders is better communication. On the cardiac PCU, one of the biggest problems that the unit is having right now is the nurses will page the NP or the PA to a phone, and then they end up getting preoccupied. The PA calls back and misses the phone call. So this is very difficult because the nurse is trying to advocate for the patient as well as the provider is also trying to advocate for the patient. But if that communication is not cohesive, the patient's care will not be advocated for. And it will be very hard for the nurse to be a leader if she is not able to effectively communicate with the nurse practitioner or the physician's assistant. I also feel like this communication could be better between the staff members on this unit. Most of the time, the nurses just kind of get in their own little worlds and are very focused on the tasks that they are doing. But leadership really is about teamwork, and I think that the nurses would benefit if they would rely on each other a little bit more. So, after looking at two nursing leadership components, analyzing multidisciplinary teamwork, and looking at resources needed to support a new nurse as a leader, I am excited to begin my own nursing practice. I hope to utilize the resources provided on my unit, collaborate with other members of the team to advocate for my patients, and continue to explore evidence-based research with the technology provided by my institution. I also hope that I am able to demonstrate leadership qualities and be a valued nursing leader for my patients and for the hospital. I will continue to complete a self-assessment of my progress towards being a nursing leader. I plan to get involved in a variety of different committees to continue to improve the nursing practice and care at the bedside. I can't wait to continue to grow as a nurse leader and impact the lives of each of my patients every day. And here is my reference page. I hope you enjoyed this presentation. Thank you.